Hey everybody, it's Dr. Dunlop, and we're here for another edition of Doing Dental Implants with Dunlop. If you remember, a year or two ago, I did a really cool surgery with my front office, Lorena. She had a big infection on her maxilla, and I had to go in and completely degranulate the infection and pack that abscessed area with a lot of bone graft. So it's been about a year or more since we did that big graft procedure. She's had a temporary bridge that looks beautiful, and we took a CT. The graft is healed perfectly. It's like native bone, and now today we're gonna go in and place 2 dental implants. So I've already given her some anesthetic, and you guys can follow along, and you'll see how quickly and easy it is to place 2 dental implants when you have the right setup and the right plan. So let's get to it. Are nicely formed because of the temporary pontics. Number 9 is a root canal tooth that I did a couple years ago, and so that's prepped for a crown. Number 10 and 11 are also prepped for crowns. So she has a single bridge that goes from 6 all the way to 11. And what I'm gonna do today is I'm gonna open this area up a little bit, flap it open, and I'm gonna place a dental implant right in the middle here, and I'm gonna place a dental implant right in the middle here. And so let's get to it. I'm gonna make a small little crestal incision here. I like to flap these. I don't like to do flapless surgery that much, especially in engrafted sites. I wanna see and feel the density of the bone. So I'm gonna make a little small crestal incision here. It doesn't have to be too big. I'm gonna release this papilla just a little bit. Then I'm gonna go in with a periosteal elevator. This is a molt number 9. And I'm just gonna tease this back a little bit. Push this gum tissue out of the way so that we can see the ridge. Push this out of the way just a little bit more. Now I can start to see the ridge nicely. Now I'm going to switch my instrument to this side, and I'm going to release the palatal tissue just a little bit. All I did was give her a couple of carpules of localized Septicaine. I like Septicaine for almost all my surgeries. It's a great anesthetic, fast acting, long lasting. And you don't have to give a ton of it to get a good profound anesthesia. So I gave palatal anesthesia right here. I gave up 1 or 2 carpules on the buccal here. So you can see the ridge is nice and wide. And let me have a small curette. I like to go in with a small curette like this and just kind of feel the ridge. A lot of this is grafted bone, so we want to make sure that our grafted bone is in good quality. Make sure that there's not a lot of granulation tissue. So I'm kind of cleaning this area up. I don't want to remove too much of the bone that's grown. This is matured over about a year, so this is pretty stable. But I don't want any soft tissue kind of hanging out. Can I have a rongeur? I'll grab this. So I'll grab a couple of little areas I see here of soft tissue. There we go. And we should be ready to start with our implant placement. I've already taken the CT and I've already planned these out. I'm gonna put 2 13mm implants right in the middle of this ridge. One about right here and the other one about right there. I have to be just cognizant of the long axis of the teeth. So I'm gonna take my 2.0 pilot drill here, and I'm gonna follow the long axis of the central incisor, because when I planned it on CT, I saw that the long axis of this tooth is the same as I want for this tooth. So I'm gonna kind of find the center of the ridge, and I'm gonna walk this down to about 13mm. Wants to pull me a little bit to the distal here. So I'm gonna kind of force this to stay where I want it, which is right there. Now I'm gonna walk this down almost to depth here. Before I get to the final depth, I'll go to the other one. And can I have a guide pin? Mm-hmm. So I'll put a guide pin into this anterior site so I can see the trajectory of that one. And I want these 2 implants to be relatively parallel. The other implant is also parallel to the long axis of the canine. And then the 2 implants are relatively parallel to each other. So once you get this one kind of situated here, it's really easy to go in and get this one situated where you want it. So we'll walk this down to almost to depth. Almost there. So I'm down to about 13 millimeters, and I'm feeling a really nice hard stop. So that should be good enough. I want to sink these implants down past 13 millimeters so that I can sink them subcrestal. So I'm going to go finish this one prep to about 15 because I want to sink it down to about 2 millimeters subcrestal, and then this one's down to about 15 as well. And that's it. So now we'll take our 3-5 drill. Now this drill has markings all the way up 8, 10, 11, and 13, or 11 and a half, 13. So I'm just going to drill these down to the same depth. So that's the 13 right there, but again, I want to put it a little deeper because I want to sink these implants subcrestal. So I'm going to go to about 15 there. And then on this one, likewise, that's at around 11. Now we're to 13, and now to 15. And that's it. So both sites are perfectly prepped. And now we're going to place our 2 dental implants. I'll put my torque down to 50 Newton centimeters, and we'll go ahead and place our dental implants. So I planned 2 3.5 millimeter diameter implants by 13 millimeters long. And I like to have a lot of bone around my implants. There's really no reason to go with a thicker implant unless you need to for stability. We're going to bury these. So the stability should still be good, but I'm not relying on it because I want the implants to fully integrate, and then we'll make crowns later. So that bottomed out right where I wanted it to, which is just barely subcrestal. Here's the next implant. That's good, so that bottomed out right there. I like to go back and always tighten the implants down by hand. Gives you a kind of a good tactile sensation of how much torque you have. You can see I have really, really high torque level here. I'm still going to take them down to about 2 millimeters subcrestal. So that's about 2 millimeters. And then if you see on this instrument, there's dots. And the dots correspond to the flat side of the hex. I always like to have a flat side of the hex facial or buckle. So I will keep clock turning this implant until it lines up like that. So now I have a dot exactly to the facial. And the implant's about 2 millimeters subcrestal. No, it's about 1.5. So we'll take it down a little further. There we go. So that's 2 millimeters subcrestal. We'll do the same thing on this one. Again, very high torque, even though it's a narrow implant. So that's good. So we'll take this one down as well. So now we're about 2 millimeters subcrestal there. And I'm gonna line up this dot to be exactly facial too. The timing of the implant just helps you choose any abutments that you're gonna use. The angles will be consistent. So now I have 2 nicely placed implants. And what we can do is put some healing abutments on. For these, we'll probably put the short ones, like the 3.5 by 2.5 or 1.5. Okay, so we're gonna put some healing abutments on. Go ahead and suction for me. Mm-hmm. So we're gonna get this cleaned off, and then I'm gonna put these 2 healing abutments on. What this is doing is just kind of helping to start shaping the gingiva, so that as it heals, we'll have a nice emergence profile. There we go. So now we can put these back together. So you can see that there's a kind of an extra amount of gum tissue, especially on the palate. The buccal bone tissue is very important, but this palatal tissue is kind of in the way. So I'll take a little semi-crescent incision there. This little crescent incision there. And that just allows me to approximate this gum tissue even better. All right, and then so we'll put a non-resorbable suture in. You could put resorbable sutures in too, but I see a little bit better healing with these. So we'll get a nice closure here. 1, 2, 3, and we'll cut both of those. We'll do the outside one here. Two, always 3 knots for me. And then lastly, we'll put one right in the center. And then lastly, we just try this bridge back in. This is the milled PMMA temporary that she's been wearing. So we're just gonna make sure that we have enough room where those implants were placed. So I'll go back and I'll just relieve this a little bit until it seats fully. All right, so I modified the Pontics just a little bit so there'll be a little bit of room here so that we're not hitting them. And there we go. Back to normal. So we'll re-cement this with a little bit of temporary cement. So I'll load this with just a little dollop of temp cement for each tooth. You have some gauze. I'll just wipe the teeth down and then seat the temporary. And we'll let that sit, and that's it. So you can see in a matter of, I don't know, 10 minutes or so, we got 2 dental implants in there. The key was the plan from the beginning. We took out some infected teeth. We did some extensive bone grafting. We took an updated CT about 8 or 9 months later, and then we, after about a year of letting that graft fully mature, now we're putting the 2 dental implants in. So anybody can do this procedure. If you're a general dentist, periodontist, oral surgeon, anybody can do this with the right training. So learn how to do dental implants, learn how to do them right, and then start doing them in your practice. Hope you enjoyed it.